Welcome everyone. My name is Kirti Khalsa. I'm the CEO of the Alzheimer's Research and Prevention Foundation. And it's my great pleasure to welcome you to this webinar called How the Science of Life, which is Ayurveda, boosts brain health now and in the future. Our esteemed speaker tonight is Dr. Charles Elder. He is an experienced physician, having studied from Boston University and served as primary care internist at Kaiser Permanente Northwest for 30 years. And where he also is the physician lead for the complementary integrative medicine program at Kaiser Permanente for 20 years. So he has an incredible wealth of information and knowledge that he'll be sharing with us tonight. And he currently serves as associate professor and executive director of the fellowship program in integrative medicine and Ayurveda for medical professionals at the College of Integrative Medicine at the Maharishi International University. So we'll hear all about this directly from Dr. Elder. Dr. Elder, I will pass the mic to you. Thank you so much for being here with us tonight.
Thank you, Kirti. It's great to be here. It's great to see all of you. Thanks for having me. So we're talking tonight about Ayurveda and brain health. Two fascinating topics and their confluence. As Kirti mentioned, I've spent a lot of my time now as the executive director of a fellowship training program in integrated medicine and Ayurveda at Maharishi International University. And at MIU, we have a range of programs to train people in Ayurveda. We have 4-degree programs and a certificate program. We have a program for physicians and licensed healthcare practitioners. We have a program for others who wish to become Ayurveda practitioners. We have an undergraduate program, an aromatherapy program. So at MIU, we are the largest provider of Ayurvedic education in the West, and we're very passionate about it. And so over the next 45 minutes to an hour, I hope that you'll come to understand why we're so passionate about bringing Ayurveda into the mainstream medical practice. This is really what our fellowship is about, and what my own medical practice has been integrating, enhancing conventional care with the wisdom of Ayurveda. So when we talk about dementia prevention, which is what your organization is all about, this is a very interesting slide, and it illustrates the modifiable risk factors for dementia. And this slide came from a publication from the Lancet Commission, published in 2020. And it's very interesting. So what we see here is that with respect to dementia, about 60% of risk, according to these authors, is unknown, but about 40% of risk for dementia is modifiable. So in other words, in theory, we can reduce our risk, our family members, our patients' risk by 40% if we were to eliminate all these risk factors. And here you see in the green, these are risk factors that stem from what happens in childhood. And then in the blue, in midlife, and in the purple, later in life. So children who don't get a good education are 7% more likely to get dementia when they're older. In midlife, hearing loss, 8%. Correcting hearing loss in midlife can improve one's risk factor profile by 8%. Traumatic brain injury, hypertension, alcohol consumption, excess alcohol consumption increases one's risk of dementia by 1%. Obesity, 1%. And then later in life, smoking, depression, social isolation, physical inactivity, air pollution. We'll talk about that. It's about the role of toxins. Diabetes, all increase our risk in the indicated amounts for dementia. And then we have this 60% risk unknown. So this is great. And these are things that as physicians, as practitioners, as family members, as friends, that we can all work on for ourselves, for our patients, for our colleagues, to these risk factors that none of them are very surprising. But now what we'll do is we'll look at what Ayurveda tells us about this, because we can potentially take this risk unknown and reduce this 60% figure even more, because there are a lot of things that we're going to, there are some insights that we can gain from Ayurveda that shed light on what's going on and that we can do something about. In addition to what we know from conventional care, from Western science, that can really help change the game. So what is Ayurveda? Ayurveda is the traditional healthcare system of India. Ayu means knowledge. Excuse me, Ayu means lifespan, and Veda means knowledge. Knowledge of lifespan. So in a sense, a science of longevity. Ayurveda is the oldest system of natural medicine in the world that's been in continuous practice. So what this means is most of the other things that we hear about and find so compelling, Chinese medicine, naturopathy, anthroposophy, etc., most of these other systems will share a lot with, will have borrowed a lot from Ayurveda, which is one of the reasons why I became intrigued with Ayurveda early in my training. And Ayurveda, of course, is prevention-oriented, holistic, whole person care. And according to Ayurveda, health is a state of balance and disease a state of imbalance of three fundamental physiologic or psychometabolic principles called doshas. And the three doshas are Vata, Pitta, and Kapha. Vata governs all movement, mind, body, and spirit. Pitta governs digestion and transformation. Kapha governs structure. In a word, when the three doshas are balanced, present in the right amounts, and functioning harmoniously together, 2 thumbs up, we're in good health. If, however, one or more doshas becomes imbalanced, that is to say, overactive due to improper diet, improper routine, some stress, some germ, some environmental toxin, that tips the system off kilter and symptoms of illness start to set in. So that's really one half, looking at a sort of 300, a global view of it, that's a big part of the equation of the pathogenesis. And anything in Ayurveda is imbalance of one or more of these doshas, where one of these doshas gets a little out of whack. And then there's a second component to it, which relates to our digestion, which we'll talk about in a little bit. But we can reframe everything and say, according to Ayurveda, everything's related to digestion. When digestion is good, we nourish ourselves. When digestion is poor, the byproducts of improper digestion build up in the system and damage the tissues. And that tissue, where those tissues are damaged, then these imbalanced doshas get parked there, and this is how disease happens. So according to Ayurveda, dementia, really any abnormality, any chronic disorder of the nervous system is related to imbalance of Vata dosha. Vata governs all movement in the physiology. It's composed of the elements space and air. It's light, dry, evasive, subtle, rough. The animal in nature to which Vata is often likened as a snake. If you think of a hummingbird buzzing around outside your window, that's Vata, all that movement. Okay, so Vata becomes imbalanced. And then in Ayurveda, there are 7 dhatus, there are 7 tissues: plasma, blood, muscle, fat, bone, marrow, and reproductive. And the nervous system is actually part of the marrow. It's part of Majja Dhatu. It's part of the marrow because it's encased, right? It's encased by bone. And so Vata becoming deposited in vitiated or imbalanced marrow, maja dhatu, marrow tissue is really the pathogenesis of dementia from the Ayurvedic standpoint. So then, okay, well, how does that help us out in terms of taking care of our patients and ourselves? So we need to balance vata. And so all those things we saw about, all those modifiable risk factors over the course, in our first slide, over the course of life, we need to modify this and that. And we should be focused on avoiding, in terms of dementia prevention, keeping vata dosha under control. Avoid aggravating this dosha, because over a long period of time, if we are engaged in activities, lifestyle practices, exposures and whatnot that aggravate vata, it accumulates over time, some weak digestion, damage to the dhatu, to the tissue, deposition of vata in the tissue, and there's where disease manifests. So what are some of the things that aggravate vata that we can work on across the span of a lifetime, especially as we approach the latter part of life, the latter third of life, but really across the span of lifetime? Well, here are things that aggravate vata and that we want to tell to ourselves avoid, and to tell our patients to avoid, our family members and the like. Wakefulness at night, insufficient sleep, night vigil, working a graveyard shift, get off it. And there are data that show that people who work the night shift, of course, live shorter lives. Mental or physical exertion, excess mental or physical exertion, working too hard, excessive work, exercise, excessive travel. People who travel, moving around, vata's moving, excess travel, not good for your nervous system. Travel is one of those things that's good in small amounts, not good in large amounts. It depends on the person. Excess travel aggravates vata, aggravated vata sets us up for cognitive impairment and dementia. Okay. Suppression of natural urges. Some people are too busy to go to the restroom. Not good for your health, short-term or long. Irregularity in daily and seasonal routines. So a regular routine throughout life is very important. Early to bed, early to rise, get some exercise every day, ideally in the morning, have a good lunch every day. Having a regular routine is good for vata, for keeping vata intact. And in contrast, really erratic routine, do this, do that, whenever I feel like it, I eat when I feel like it, I go to bed, I sleep when I feel like it, aggravating the vata dosha, and over time will cause us problems. Falls, injuries, bone fractures, breaking bones aggravates vata. Okay, we're going to have a time permitting, we'll talk about diet quite a bit later on. But simply to say that here, erratic dietary patterns are not good. And then to balance vata, we want to favor foods that are warm, oily, sweet, salty, and avoiding foods that are rough, dry, light, hot, spicy, bitter. So in Ayurveda, we will prescribe certain types of foods depending upon their taste and their qualities, because depending upon the taste and the quality of those foods, that tells us how the food impacts the dosha. And in the case of balancing vata, we want to favor warm, a little heavy and oily, and stay away from cold, rough, dry. Again, the sort of high-level view, and we'll talk more about diet. Weather and season. Okay, dry, cold, windy weather aggravates vata. Warm, moist weather balances vata. Okay, so moving to a warm, moist place, when you get to be older, that's not such a bad idea for your health. That will balance vata, but anything that's, if you're living in, where is it cold? And when you're living in Salt Lake City, or if you're living in, I mean, Portland's wet, but it's cold and it can be windy. places where there's a lot of wind, and especially cold wind, will aggravate vata and are not good in excess for, especially as we get older, because that's the time where we're more prone to dementia, as we'll talk about in a second. Excessive weight loss, then certain seasons of the year, the winter, when it's cold and windy, aggravates vata. Now, we mentioned that vata, pitta, and kapha govern our nervous system. Govern our nervous system and the physiology. There are also rhythms of the seasons and rhythms of life that revolve around vata, pitta, and kapha. So we mentioned that there are seasonal cycles of the doshas. Winter, when it's cold and windy, is vata season. Vata comes up in everyone. According to Ayurveda, the first part of life is the kapha season of life. The second part of life is the pitta season of life. The last part of life is the vata season of life. So any vata-related disorder, we're all more prone to during the last third of life, say age 60 onwards. Whether that be, so all of the, or most of the diseases that we associate with quote unquote aging that are really so much more common in older people are vata imbalances as a general principle. So for example, dementia, the mind has lost its grounding. Osteoporosis, the bones are too light and brittle. These are all vata disorders. And the solution in terms of prevention and reducing risk from Ayurveda standpoint, balance vata, all these things we're talking about. Excessive weight loss imbalances vata. Now, perception, this is very interesting. We just had in our fellowship, we just had a course on 5 sense therapies and framing things from a different way. The root cause of many illnesses are overuse, underuse, or misuse of the senses. So improper use of the senses over a span of many years aggravates vata, increases our risk for any vata-related disorder, including dementia. So watching scary movies, exposing ourselves to raucous music, watching violence on the TV, on YouTube, on your phone, exposing ourselves to any penetrating, frightening sounds, sights, smells, tastes once in a while, that's what life happens, but on a persistent basis will increase our risk for dementia and should be avoided. Fear, grief, worry, anxiety, agitation, all these things. Okay, so anything we can do to balance vata helps, because the vata imbalance is one of the causative factors of dementia, according to Ayurveda. And here we see a few other causative factors. Aging, as we said, that as we get to this vata season of life, we're more prone to dementia. Stress, this is an important one and doesn't surprise any of you. Feeling disconnected, social isolation, lack of family support. In Ayurveda, we would say loss of dharma. In other words, loss of purpose, as the bullet point says. You don't know what to do. Yeah, just what it says. Loss of hope. And then environmental pollutants, which includes excess processed foods. We'll talk a little bit more about that. So these are all the causative factors that we want to remove when our patient comes in at age whatever, 50 or 60, and says, both my parents have dementia, what can I do to prevent it? Okay, so now let's talk about some specific modalities that we'll recommend to our patients for dementia prevention. And the most important thing, I know this small print is a little hard to read. Don't worry about that. But just the diagram here, let me explain it. So one of the modalities that's really important, very helpful for keeping the physiology balance and the central nervous system balance are mind-body techniques. And especially, of course, we're at Maharishi National University, and we teach all of our fellows and encourage our patients to learn the transcendental meditation technique. And TM is a simple mental stress reduction technique that's very easy to do and has been shown to be helpful. I'll show you some data in a moment in preserving cognitive function, improving longevity, and there's loads of data on TM across a range of health conditions. And so what happens when we meditate is it's a very simple process where the awareness, which right now, as I'm talking to you, my awareness is external, but the awareness easily fades or contacts the silent place within us. Here it says all-knowing consciousness, or the state of being. That's our true selves. So, or a place of quiet or serenity, we could say. And it's a very innocent and easy technique, and it balances the entire physiology. So when we say that, well, TM is good for preventing dementia, what does that mean? It doesn't mean that you're meditating to prevent dementia. You're not meditating to preserve one's cognitive function. Rather, one's meditating to benefit one's whole physiology. Because in Ayurveda, the normal state is ideal health. And when we start getting sick, chronic illness develops, there's some mistake that's being made. And so we're simply restoring the physiology to the natural state. And this is how regular meditation practice facilitates the health of the central nervous system. A good analogy is a tree. Let's suppose you've got a tree in your backyard. It's been a bit of a drought, and the tree's not looking so good. So some leaves here that are turning color, and there's some flowers there dropping off, and there's a branch there that's looking sickly. And you could go, like we might do in allopathic medicine, and treat the leaf, and treat that branch, and treat that flower, or water the root. Water the root, and then let nature heal itself. And this is the approach we're taking when we meditate. Okay, here's some data from a classic study that was published a few decades ago, but it's a classic study. It was in the Journal of Personality and Social Psychology. And what the investigators did is they went to about a half a dozen residences for elderly people, a nursing home, assisted living, and such. And they recruited 73 residents of these facilities with a mean age of 81, and they randomized them to one of three groups. One group learned TM, another group learned a mindfulness technique, another group learned a simple mental relaxation technique that was neither of these two, and then a no treatment group and the remainder of the participants. Okay, and they collected a range of cognitive performance data before and after training. And what the table here shows is that across a number of cognitive performance measures, including associate learning scale, word fluency scale, and the overlearned verbal task, comparing the TM group did very well and outperformed the other interventions in most of these measures. Okay, now if you look here, this is a really very interesting bar graph. And what this bar graph shows is longevity. So people enter this study. 3 years later, what percentage of people were still alive? And here we can see that all of those who learned TM were still alive. And this is the mindfulness group. This is the mental relaxation, the no treatment. So very significant results in this classic study. And there are many studies on TM and cognitive function. This is really one one of the better ones. Okay. Now, so that's a great recommendation for all of our patients. Now, yoga asanas can also be used for prevention. And in the way we teach, people have this is Sarvangasana is one of the asanas that promotes CNS function by enhancing brain blood flow. But the way that yoga asanas are often misunderstood because people think, oh, you got to stretch and really push yourself and the like. And it's not like that. The way we train our fellows and our patients is we stretch just until it's comfortable and easy until we feel a little stretch and we focus on that sensation of stretch and then return back to our baseline position. Easy, relaxing, and a range of medical benefits. And this is a very nice chart that appeared in a review article on yoga and pranayama. Pranayama, the breathing exercise, is another great modality for brain health. And here we see the impact of stress, anxiety, the impact of stress on anxiety and mental health. And it shows the different physiologic mechanisms. And where you see an asterisk, these are areas where performing of yoga asanas have been shown in the biomedical literature to have a favorable impact. All right. Here's a picture of sesame oil. So sesame oil, in Ayurveda, we have this procedure, we call it abhyanga. Abhyanga means massage. And we will advise our patients to perform a head-to-toe self-massage with sesame oil immediately prior to taking their shower every day. Now, sesame oil has been shown to have very potent anti-inflammatory and antioxidant properties. It has anti-nociceptive properties. It's useful for chronic pain. And for performing this massage on a daily basis is very good for your skin, for toning the muscles and the joints, and for balancing vata and for stabilizing the nervous system. So this is a great modality. Now, one thing I will mention is that I often hesitate. So a lot of my patients do this. I hesitate to instruct elderly people to do this sometimes because we don't want people slipping in the bathroom because this does generate a lot of oil on the floor. But worth mentioning that topical massage especially with sesame oil and the benefits, many of the herbalized topicals in Ayurveda are sesame oil based, an outstanding massage oil for most people, and certainly for balancing vata. Now this is every bit as relaxing as it looks like. This is called Shirodhara, and here this is a person who's getting Ayurvedic Panchakarma therapies. And so let's talk about what that's all about. So Panchakarma means 5 actions. And in Ayurveda, there is an ancient science of detoxification. Because, we said one thing, we have this issue of keeping vata balanced, but then, life happens and imbalances accumulate in the physiology, and then we need to remove them. And there are some simple home things that we tell our patients, but if there are deeply rooted imbalances, it requires quite a lot sometimes to remove these toxins. So there is this sequence of treatments called Panchakarma, 5 actions, which are like, we would think of them as spa treatments. In India, they're inpatient treatments. And they involve elimination therapies and proper diet and like that. And then in the preparation for these panchakarma therapies, we oleate the patient. And so the patient will come in for a week of massage, special diets, and then some special topical oil applications to sort of or to loosen up the toxin in the system before they're eliminated. And so this procedure is called Shirodhara, which is very good for Vata. And one lies there, it's every bit as good as it looks like. And the technician pours this warm sesame oil right here on your forehead for a few minutes. It's very relaxing. Okay, and this is just some data showing that these Ayurvedic, these Panchakarma therapies, widely practiced in India, especially in Kerala and the south of India, for thousands of years. And there are some places in the United States where that are competent. We have two Panchakarma centers in Fairfield, Iowa, where our university is. And this is data collected at our university showing reductions in PCB levels for patients undergoing Panchakarma treatment. Okay, so we talked about mind-body. We talked about balancing Vata and specifically mind-body. And we've talked about some yoga and Panchakarma. Okay, let's talk a little bit about the Vata balancing diet. And diet is one of these areas where Ayurveda is really, really sophisticated. So each of these systems has their strength. So, so Chinese medicine, acupuncture for pain management, for example, or chiropractic for the spine, very good with a manipulation or osteopathy. Ayurveda is really, really smart about diets. Very sophisticated idea of food as medicine. And so we will tell people to favor or avoid different foods based upon the tastes and the qualities of the foods. Sweet, sour, and salty foods balance Vata, whereas bitter, pungent, and astringent foods aggravate Vata. Heavy, oily, heating foods balance Vata, while light, dry, cooling foods aggravate Vata. And so it's not all or none, but as a general principle, warm foods, little oily, sweet, sour, salty, in the right amounts are to be favored to balance Vata. And here we see our favorite cooking oil in Ayurveda, which is ghee. According to Ayurveda, the ideal diet is a lacto-vegetarian diet. We don't make a big deal out of becoming vegetarian necessarily, unless the patient wants to. But ghee, according to Ayurveda, is the ideal cooking oil. Others are also good. So we'll give our patients lists of foods to favor or avoid to keep Vata balanced. So amongst the grains, wheat and rice are heavy grains relative to, say, barley. So more wheat and rice. Legumes, almost all nuts except peanuts are good for balancing Vata. Veggies are generally good if they're cooked with a little bit of oil, and if they're raw, and especially with no oil, not so auspicious, especially for Vata. Dairy products, different sweeteners, and you can see, excuse me, and we can see here the different spices, which are good. It will sometimes give our patients a pre-mixed spice mix to sprinkle on their food. Fruits that are sweet, most fruits are good for Vata, but not dried fruits, right? Unless if you soak it in water, it's okay. Soak it overnight. But anything dry, Vata's dry. It's contraindicated, except in very small amounts. So, as a general principle, tips to tell you, so you can go online and Google Vata balancing diet, and you'll get a million hits and pick one, and you can look at that and see what makes sense. Sometimes these long lists of foods are a bit much for some patients. Okay, so in a word, for Vata, favor warm, oily, well-cooked, fresh food. Sweet, sour, and salty. Eat in a settled environment and on a regular schedule. With lunch as the main meal, because when the sun is highest in the sky is when nature supports our digesting our biggest meal. For Vata, things to not do: stay away from cold, dry, raw foods. People think salads are good for you. Well, a little bit of lunch, okay. Vegetables are good for you, but they need to be cooked, and especially for Vata, with a little bit of oil. Raw veggies are hard to digest. It's too dry. Avoid leftover and processed foods. Leftover and processed foods, they generate toxins in the system. And if you recall from our discussion 10, 20 minutes ago, those toxins depositing in the tissues are the ground floor where disease gets in to allow that dosha to come in and manifest disease. Avoid grazing and snacking, eating on a regular schedule, especially for Vata types. Allow when you eat, allow what you've eaten to digest before you eat again. Usually takes about 3 hours. Main meal midday, don't overeat at night because your digestion's stronger during the day. Okay, so those will be the tips for balancing Vata. Excuse me, the dietary tips for balancing Vata. And then there is another side to this still, because one of the things that we will tell people that we will that's important about diet, in addition to eating the right foods to balance Vata, is eating properly just to keep your digestion strong and to avoid toxin accumulation, right? Because we have this keeping Vata balance and then keeping the digestion strong and clear of ama. Ama is what in Ayurveda we call digestive toxins, or that's how we would translate it. And because this is the improper digestion, environmental toxins, this is the ground floor where disease gets in, according to Ayurveda. And here's a quote from Charaka Samhita: "The fire of digestion and metabolism is the root cause of everything. The nourishment and maintenance of the tissues of the body, immunity, strength, complexion by food depends on digestion and metabolism." Charaka Samhita is the oldest of the classic Ayurvedic texts. Scholars date the Charaka Samhita to about 2,500 years ago. Okay, so aside from foods to favor and avoid, favor sweet, sour, and salty, avoid bitter, pungent, and astringent, all these things about how and when you eat are applicable really to just about everyone. Eat in a settled and quiet environment. Lunch should be the main meal of the day, because when the sun is highest in the sky is when nature supports our digesting our biggest meal. Avoid cold beverages and foods because they interfere with digestion, okay? According to Ayurveda, cold drinks are off the menu. Room temperature is fine. Warm things are beneficial. Okay, if it's 105 degrees out and you live in Las Vegas and you want to put some ice in your water to get it down to room temperature, you can, 70, 75 degrees, but nothing cold. It's contraindicated for anyone, especially for the type of condition that we're talking about. So weak digestion, improper digestion, if we're eating at the wrong time, we're eating in the wrong place, we're eating the wrong food, we're watching TV while we eat, we're doctors and we're doing our charting while we eat, we're not digesting our food properly, it leads to the accumulation of ama, which are digestive toxins, and can lead to indigestion, constipation, mental and physical fatigue, blocking of the channels, heaviness, laziness. So these are the short-term symptoms of what in Ayurveda we call ama accumulation or toxin accumulation. And as mentioned, over time, these toxins will deposit in the various tissues and organs of the body. And then where there's an imbalance, the dosha that's disseminating in the system, it will get stuck in that ama, and this is how chronic disease sets in. So I was once at a conference and there was a cardiologist speaking, and he showed a picture of a clogged coronary artery, and he said, this is what ama looks like in cardiology. So in neurology, here we see the photomicrograph of the human brain and Alzheimer's disease, and we can see the classic neuritic plaques. And this we would call, this is how AMA manifests in the nervous system, from our perspective, from the Ayurvedic perspective. So then there are a whole set of things that we tell people to do um, to keep themselves free of toxins. And we talked about a lot of them. Trying to eat organic foods if you can. Eating at the right time of day, avoiding processed foods. We'll give people herbs, spices. Including a lot of spices in your food is very important. Turmeric, coriander, cumin, fennel, pepper, not just for the taste, but because they enhance digestion. So lots of spices in the food. Cleansing of the digestive tract. That doesn't have to be a big deal. We'll tell people to do a 24-hour liquid fast once a week or once a month, depending on their body type, for cleansing. And it's easy. And if you go from lunch to lunch, it's easy. Have a normal lunch, only liquids to lunch the next day. And it is very, very, easy and effective. Enhancement of the digestive tract, elimination therapies such as the Panchakarma therapies that we talked about. Okay, finally, I'm just going to mention that there are some herbs that we use in Ayurveda. We use herbs quite a bit. Ashwagandha would be a classic supplement that could be useful for mind, body, and stress, and it's readily available in the United States. Decreases vata, excellent for calming the mind. There's a good product available. Another classic supplement is Brahmi, Bacopa, which you may have heard of. And there are data in the biomedical literature showing an impact on memory and intellect. And then you can take the Brahmi, and we'll often infuse it with ghee and have people take that sort of as a paste, either orally or it can be melted and inhaled, okay? And very potent. And I just want to show you this. This is a supplement, Mind Plus, that I get from a supplier of ours, Maharishi Ayurveda, and it's very good for the mind. But the only reason I'm mentioning it is that it's a combination product. Most of the time when we use herbals in Ayurveda, it's as a combination. We use combination products. You generally use single herbs all the time, and the herbs are part of a holistic intervention. We wouldn't say take Brahmi every day and all your cognitive problems are going to be solved. No, the herbs are part of a holistic program which together work on a holistic level. They're not like drugs. We don't use them. We don't think of them like drugs. They're, just as I said, part of a holistic program that moves the physiology to a settled state. And even the herbs that we tend to use combination products for a better synergistic effect. So we've talked about Vata aggravation and the need to balance Vata dosha through mind, body, yoga. We can use herbs, diet, daily routine, Abhyanga, Panchakarma, massage, elimination therapy. So Ayurveda is very, very rich, and we really only scratched the surface. Very rich in this area. And then we'll start questions in a moment. I just want to mention that we do have, if you're a medical doctor, a nurse practitioner, a PA, or a naturopathic doc, we have a program, a fellowship program. We have another program for physical therapists, nurses, or really anybody who, with a bachelor's degree, who wants to get training in Ayurveda, a 3-year MS degree program, an aromatherapy program. So please contact me or go to the MIU website if you're interested in any of these. It's great opportunity, great educational opportunities at MIU in that area. Thanks. Questions?
Thank you very much, Dr. Elder. This was fast and furious, right? Introduction and overview to Ayurveda, and I knew a little bit about Ayurveda, but I think it was fascinating. So please put your questions in the chat. If I may summarize it very, very simply. Well, first of all, I found that the idea of a traditional medicine system is fascinating. It brings us away from our standard, Western thought of here's an illness and we do this for the illness. So we're happy and we're honored to offer this to you because of the 360-degree approach to it, right? So we see that it's not just something in the brain, it's not just something in your, even in your spirit. It encompasses everything that we do. And so if I may summarize it like in 2 sentences, is the idea is that toxins is what affects our life, our health and our lifestyle, and toxins can be eliminated by, well, first of all, eating the right foods and having the right lifestyle. I'll just say that way, but also improving our own digestion, which is how these toxins, a big part of how the toxins are even caused, but can be eliminated as well. Is that accurate enough, Dr. Elder?
That's an excellent summary and completely 100% true. One thing so in three sentence elevator talk, that was perfect. One thing I'll add is, so sometimes the elevator talk is Ayurveda is about digestion. But another perspective is Ayurveda is about proper use of the senses, because at another level, overuse, underuse, or misuse of the senses is a cause of disease. And at another level, Ayurveda is about removing the mistake of the intellect. We call it pragya parad. In other words, meditating, in other words, bringing our physiology into synchrony with our being.
Right. So we have questions, and I definitely want to get to it. I do want to mention, because we have people here who are familiar with the work of the Alzheimer's Research and Prevention Foundation, that we have done about 25 years of research on meditation as well. And so since 2003, we have quite a wealth of articles published also on meditation, and maybe we can talk about that at the next webinar with Dr. Elder. But meditation is very, very important. So I'll go to the questions. In Ayurveda, what is a healthy elimination schedule for each day?
Very good. So the normal time to be hungry is 12 noon, and the normal time to have a bowel movement is first thing in the morning. And now this will vary from person to person, but if you wake up in the morning, have a glass of warm water, have a bowel movement, that's a sign that your gut is in tune and your physiology is in tune. Skipping days in terms of bowel movement is not so auspicious. And even if someone's having a bowel movement every day, but it's later in the day after lunch, still considered constipated. So bowel movement first thing in the morning.
Okay.
And then maybe some people have a second or third. That's not necessarily problematic, but first thing in the morning, complete bowel movement.
Do you recommend any specific books to read about balancing Vata? And this is fascinating.
Yeah, so there are loads of very good books on the topic of Ayurveda. We have a book my wife and I published called Picture of Health.
Oh,
that you can get from Amazon or from our websites. Picture of Health MDs is the website.
okay.
Obviously, it's my favorite book on this topic. But there are many there are many good books on Ayurveda out there.
Okay, thank you. Um, and then does this program help those already diagnosed with Alzheimer's?
Absolutely. So no miracles, right? But we certainly can hope to achieve overall better health and improvement of symptoms by using these modalities for patient and for caregiver.
Okay. Would you recommend doing it under the guidance of a licensed professional or?
Right. So this is tricky. So you want to find an Ayurvedic practitioner or someone who can give you some advice. That's always helpful. A lot of the things that you can gain a lot of insight from reading and from doing certain things, and that can be very inspiring. But finding an Ayurvedic practitioner in your area can be very helpful, even if it's even a telehealth consultation can be beneficial.
Right, right. Especially probably if somebody has a chronic condition or even, Alzheimer's.
Absolutely, it's good to get the insights of an experienced practitioner.
Right, right. Yes, next question is, please explain how Ayurveda enhances the health for older adults.
So Ayurveda enhances so a number of ways. Number one, it's Ayurveda, knowledge of lifespan. It decelerates the aging process. It keeps us younger longer. So everything we're doing is to preserve the perfect functioning of the physiology. So maintaining cognitive health, maintaining energy level, maintaining physical strength, maintaining digestion, maintaining mental health. These are all benefits that we would expect to see from a patient coming in. We engage whatever the presenting complaint is. We work with that, we focus on that, but then we have all these side benefits as opposed to side effects. Because we're
Great,
balancing the whole physiology.
great, great. I love the sentence that you had that Ayurveda moves the physiology to a settled state. Thought that was very, very masterful. Anyway, the next question is, how about using sesame oil for massage in the shower?
You could, we usually, the oil massage procedure is to do this massage, and you can look on our website, you can look on YouTube for videos, is to do it before and to allow a few minutes for the oil to sort of set in. Ideally, if 5 or 10 minutes for the massage, sit there for 5 minutes, and then shower it off, a warm shower or bath would be the usual recommendation.
Okay, okay, great, thank you. There was something else I wanted to mention for everyone that you spoke about the prevention paper on the Lancet from the Lancet Commission on Dementia Prevention, and we, the Alzheimer's Research and Prevention Foundation, published a white paper summarizing that very long medical paper. So we'll put that link in the chat. If anybody would like to download it, it's written in a little simpler language than strictly medical language. So we wanted to offer that. I was pleasantly surprised to see that in your slides, Dr. Elder. And then one other thing is about processed foods. I would like, if you don't mind, that let's talk about that for a moment, because we're all guilty of that, right? This day and age, I mean, most of us use some foods that are already pre-packaged. So Tell us a little bit more about that and maybe some tips how we could maybe curb that.
Less is more on the processed foods. So, or stated another way, fresh is best. So as best as we can, we want to cook at home and cook fresh. And it's not intuitively, that's okay. That's not hard to understand. It is difficult in our society. But again, this is, you've got someone, the 50-year-old who's got the parents in their 80s who have dementia and wants to prevent it. These processed foods, they will not be digested completely. They will generate AMA.
Mm.
It's that simple. And uh, so anything. So we want to avoid toxic accumulation. So putting fresh, wholesome food in, eating it the right way, and from time to time cleansing is the solution. But no, I know these are things that are hard for people to swallow often in our society. Avoiding processed foods, trying to minimize the leftovers, trying to minimize the restaurant foods, trying to minimize the microwave. So this, we need to go easy with people because it's a lot for people in our society. But all of these things are unhelpful ultimately for our health. One of the tricks that we use in our home is we own 3 or 4 crock pots. We do a lot of cooking overnight in crock pots, and we use thermoses if we're going to work and like that. And then you can cook fresh at home fairly conveniently.
That's interesting. And we have another question, but I wanted to kind of interject a comment because speaking about how this is a lot for the average person, right, living in the U.S. The pace of life and all that goes with it and the stress level. But one thing that came to mind is you had mentioned about for example, the wind, how living in a cold, windy place is not ideal. But of course, there are people that age in Oregon and in Minneapolis, and of course they can't just move. So could you give us some tips on how that can be mitigated? Because I know there are tips to mitigate some of these factors.
Right. So these are all risk factors. And so we'll all have some risk factors that we can't eliminate. So it's just that for this particular problem that we're talking about, cold, wind. So I live in Oregon, so the Columbia Gorge is cold and windy. I mean, there's a windy. So in Portland, it's not quite so windy. But these are things that just to think about. I mean, I think that for some people will be a modifiable risk factor, and others it won't. I mean, some people can move to Florida, and others can't.
Right, correct.
But then there's all the other things we can do. If it's just that, yeah, it's you that if it was just that one thing, but it's not because there's a whole set of risk factors that are involved. One thing I want to mention, Kurti, is we talked about all these things and it's difficult. This can be made very simple for patients. You meet the patient where they're at, and now we understand these concepts, and so you do what they can do. So for diet, eat warm food and not cold food at lunch and a little less for dinner. That's it. That's it. Most people can do that, or even say, don't eat so much at night and don't eat so much cold stuff. That's it. And that most people can do, and that will have an impact. We'll have people come to our clinic sent from the GI clinic with functional bowel disorders, and we simply tell them, have your main meal at lunch, don't eat so much at night, use more spices in your food, cook your food, nothing cold, nothing raw, and they get better.
Perfect. We're right at the hour. We have 2 questions. If we could do really quick answers. How can we boost metabolism? Quick answer.
So boosting metabolism, eating the right foods and using plenty of spices in your food. Plenty of spices.
Great, thank you. And then what about if somebody showers in the evening?
Okay, not a problem. Morning's best, evening's fine if that's when you have time.
So
Probably.
they can use the sesame oil.
Yeah.
Indeed. Thank you, everyone. This was so informative. Namaste, everyone. Dr. Elder, thank you very, very much for sharing your time with us and your skills. And Dr. Prasad, who's here, uh, facilitated this webinar. So look forward to seeing you next time, and have a great evening. We'll be in touch.
Thank you all. It was a pleasure.
Thank you, Dr. Elder.